So what I'm going to do now is I'm just going to share some thoughts around our conversations around gun violence. And this is something that Viviana wanted me to share with you all because last week I was able to get a publication out through the Journal of the American Medical Association Health Forum. The Health Forum is a open forum, so it's accessible to everyone. You all can click on that link and see what I'm referring to. And I wrote this piece because I was very concerned around some of the conversation and media coverage that has been really focused, I would say hyper-focused on gun violence as a mental health issue. Not to say that mental health is not an important component of it. I very much think it's an important, critical component to it, but I was worried that we were not considering and learning from all the lessons that we've had as a country and globally on accomplishments that we've had in public health. And so what I did there in this piece is really look at different accomplishments that we've had in public health and try to see what kind of lessons that we've learned from those accomplishments could we apply to a comprehensive approach to addressing our gun violence problem. And so I think, in our previous conversations, we've talked a lot about the impact that this has had in our own community and highlighted some of the disparities on there. It's really, I think the major point here is that this doesn't have to happen. We don't have to live like this. And we're an outlier when we compare ourselves to other countries globally. So the prevalence of gun violence mortality in the United States is 25 times higher than any other high income country. And that's just not acceptable. As well as when you look at the inequities, it's really sad to see the same patterns of inequities play out on different health conditions, but there's some conditions that these inequities, the gaps between people affected by it are more stark. And this is one of those examples. And it's particularly acute among Black men. Black young men are 22 times, that's like a huge 22 times more likely to be killed by gun violence than non-Hispanic white individuals. So, these the focus on the individual level mental health and all these inequities, both when we think about us as a country compared to other high income countries, and then the different groups within our country is just really unacceptable. So what have we learned from things that we've done well in public health? The one thing we know is that when we have policies that are coupled with individual and more community level strategies, that we're able to have a bigger impact. And we've learned a lot from tobacco control. We've had major accomplishments worldwide around reducing smoking. Of course, we have other problems that more recently with vaping and other things, but we learned from the whole public health approach to tobacco is that when the world comes together and sets priorities and policies and countries are implementing comprehensive policies that do things like limit access to tobacco, raise the cost of cigarette smoking, that those things have a big impact on reducing certain behaviors. And so in thinking of that, there's a lot that we can do around policies, around limiting access to guns. And that has certainly been something that has come up a lot in our conversations. We know, unfortunately in the United States, we've had limited funding for firearm research. More recently, we're starting to see the NIH and others and the CDC start to fund more research on gun violence and gun violence prevention. But we do know from the research on other countries, particularly in the case of Australia, that when they implemented more stricter laws around who has access to guns and what kinds of guns are available, that does have a huge impact on reducing gun violence. And it has an impact on reducing homicides, and it has an impact on reducing suicides as well, which is we know is a real big part of this problem. The other thing that we've learned from major public health accomplishment is in the whole area of motor vehicle safety. So when we switched our approach in motor vehicle safety from promoting people to put on their seatbelts, like everyone put on your seatbelts, to re-engineering our cars. So they have those beeps when we don't put on our seatbelts, when there's other innovations in the way that cars are built around safety, that in itself has had a huge impact on reducing fatalities and injuries that are related to motor vehicle accidents. So I think we could apply those lessons in thinking about what are some engineering solutions that we can have around gun safety. And there's some research that has shown that having more access to gun safes and trigger locks are really effective in preventing injuries and injuries related to firearms. And there's a new series of research that's coming out that's demonstrating that when healthcare providers are talking to parents about gun safety in the household, that actually has an impact on the reducing access to gun safes and safer engineering solutions for gun safety. And so the last example that I gave in there is, I think, something that's really relevant to our work. I actually referenced Latin 19 in this writing and talk about the importance of combining these policy level kind of strategies with also attention to hyper local responses. Really paying attention, what are the unique characteristics and the unique strengths of communities that we can build upon? How can we leverage trusted sources, trusted initiatives to really make an impact on the communities that are most affected by gun violence? And we know that in this whole area of gun violence prevention, there's a really effective model that's called the Cure Violence model that treats violence as an infectious disease and really takes on a public health approach. And here the idea is that gun violence is predictable and therefore could be prevented. And they use violence interrupters who are people that are from the community. It's very much like a community health worker model, thinking about who is in the community that has credibility that could be leveraged to be able to sort of predict what's going on in terms of gun violence and intervene in those approaches. And I'm super happy to know that we in our community, we have this model that has been supported through the Bull City United initiative. And it'd be wonderful to maybe in a subsequent conversation be able to invite them and hear more about that important work that they're doing. So in summary, those are some of the major, I think, accomplishments that we've learned from different public health achievements that we could apply. I hope that we could apply to addressing our gun violence problem.